During a consultation with a consultant, you may be offered an operation. When you are offered an operation, then the consultant has to discuss with you the operation and all the factors that relate to that, including outcome, risks, complications. This forms part of the consent process and allows the patient to come to an informed decision with joint decision making between the consultant and the patient. Now, this decision making is often influenced by the consultant to some degree because they are the expert and they have the knowledge on the things that the patient needs to know about an operation before the decision is made. From a consent point of view, I split operations into two types. The first type is time sensitive. Now, with time sensitive surgery, this means that there is an urgency to get the surgery done, else the outcome would be compromised. So for an example, in this case, if you have a hand injury and you have a structure that needs repairing, then it is time sensitive, and it's often a fairly easy decision once the consultant has explained the need for surgery. You then have the operations that are not time sensitive, where you can wait. And an example of this would be osteoarthritis. So with osteoarthritis, there is no urgency to have the surgery, and the symptoms are often pain or decreased range of movement. The operations for osteoarthritis, it is most likely that you're going to get the same result whether you have the operation straight away or whether you have the operation sometime down the line. Therefore, you can decide to delay surgery if you're managing with your symptoms, and then when you do eventually have surgery, if it is needed, then your outcome will not be compromised by the delay. You do have some operations that go in between those, time sensitive and not time sensitive. For example, nerve compression, where you don't necessarily need to do an operation straight away, but if you leave it too long, then the nerve compression can cause damage to the nerve, and therefore you may not get as good a recovery. What you have to bear in mind when deciding an operation is the outcome of an operation is not guaranteed. An operation may not work. So for example, you may have an operation that goes perfectly well, the consultant's done everything they need to do for the operation and there's been no complications, but it just does not work. You still have the pain, you still have the problems that you had before the operation. Also, on top of that, you do have potential risks and complications from any surgery, which could make your outcome worse, and you could end up being worse than you were before you had the operation. So you have to balance that with the chance of a good outcome following the surgery, and the consultant needs to be able to discuss that with you and also discuss what the outcome should be and what you are likely to achieve by having that operation. So during this consent process, you'd expect the consultant to discuss the operation itself, a little bit of the detail of the operation if needed, and the potential outcome for that operation and the percentage chance, as it were, of a good outcome. You'd also expect a discussion of the risks and complications for surgery and an estimate of the percentage chance of those complications. You also need to discuss what happens if you don't have the operation. So if I don't have the operation, will it cause me harm? Do I need to have the operation at all if it's not troubling me that much? So in summary, when you're offered an operation, you have to discuss all these points in order to give you enough information to make an informed choice. And if you find you haven't got enough information to make an informed choice, then just ask the consultant more questions, or if it's an operation that's not time sensitive, then you've got time to think about it and go away and come back.